Pain management is important to people's quality of life. Care staff need to know when people are in pain and how to respond.
When I first got the pain before the morphine, you give a score out of 10, I was 9. Really hard, sharp, fierce jabs of pain.
People may not always report pain.
I would certainly encourage Tom to say if he was in pain, but at the same time recognising that his idea of pain is probably very different to mine, and that he might not express that he's in pain until he's in very severe pain.
Pain's one of those things that can really make people feel miserable, totally disinterested, not want to be involved in anything. And actually, if you alleviate the pain, you actually lift people's moods, you'll make them feel so much better, and they'll get far more involved in what's happening around them. People will express pain in different ways because there's so many different types of pain that people can experience. We need to understand what those different forms of pain are. So it might be emotional pain, it might be physical pain, it might be a sense of loss. So some people can tell us, my arm hurts, my leg hurts. But equally, some people can't tell us. So then we've got to pick up on what's happening with that person to identify that they're experiencing pain. And it may be that they wince when they move. It may be that they're constantly rubbing an area. It's all those subtle things that we have to be very aware of so that we can then take the appropriate action. You'll see various things like hand massage, head massage, foot massage. You'll also see things like physiotherapy. So that can alleviate pain when it's related to joint stiffness and contractures. Obviously, there's always medication. And, frequently we look at giving people medications such as paracetamol to alleviate any physical pain.
No one should have to live with pain as medication is available. Pain relief medication should be regularly reviewed. People with dementia may not be able to tell you that they're in pain.
I can just look at Jack and know there's something wrong with him. I can just know by looking at his face.
Well, I suppose you get used to people, you know all the do's and the don'ts and what the habits are. So if these habits slightly change, even if it's just a subtle difference.
But if he's a pen, he does look different. He looks completely different.
Do I look vacant?
No, you don't look vacant. He just has this worried look on his face,
But when people have dementia, particularly as dementia progresses, they have difficulty expressing pain. So they may still feel the sensation of pain, but have difficulty expressing it, and it's therefore under-recognised and under-treated. So we're off to visit Margaret and Jack, but today we're going to talk to Jack about how he is, how things are generally for him, and how he's coping in terms of any pain or distress that he might be feeling at the moment. With people with dementia, truly understanding a person is very important. Good afternoon.
Hello, come in.
How are you? Does pain cause you to get angry sometimes or get frustrated?
No, not with that.
Yes, you do.
What? I don't get annoyed.
No.
I don't shout and jump about.
Oh, you don't shout, but you do get annoyed. You get very quite angry with yourself.
Right. I've got arthritis, or the stages of arthritis, and the longer you sit and do nothing, the pain seems to increase. Where if you get up and you walk about, you're moving all your muscles, your bone ends are wiggling about, and it stops the pain. So really, it's a case of getting out and doing exercise, which keeps the arthritis away.
And sometimes on the morning, he can hardly walk when he gets out of bed. But he says once he's walked for his paper and come back,
it's just exercise, really. And walking for my paper is an exercise, so when I come back, I'm okay.
Yeah.
Support may be needed to remind people to take medication.
In early stages of dementia, the person may be able to express verbally if they are experiencing pain and seek medication for that if that's going to help. We need to be mindful that someone may forget to take medication at an early stage, or they may take medication and then take medication again because they've forgotten they've already taken it. Medication management is very important in early dementia.
You forget. It just doesn't enter your head. And if without Margaret prompting me, things don't get done.
Yeah.
And mainly my tablets.
Right.
And everything else in your life.
You'd think like after a few days, I've got to take tablets every morning. But it just doesn't enter your head.
It's up to
And
me.
she'll say, have you took your tablets? No. And this is maybe 11 o'clock. And I'm supposed to have them between 9 and 10.
It's important to take medication for pain as prescribed, but it's also important to keep it under review. When you're trying to support people with pain, use comfort measures in terms of massage, touch. We can use baths as a nice form of relaxation, warm water. If someone with dementia has pain and it's not treated or not considered, that can have a significant impact on their whole well-being.
You're going to lock the door?
Fun.
Well done.
Well, Tom's generally very active, so he does things like gardening and conservation work, but he also has just recently started going to the gym, which he really enjoys.
Right.
Exercise can generally make you feel much better about yourself, and it's equally important for any of us as it is for Tom. Tom has an incredibly high pain threshold, and so it's not something that he would verbalise.
So Tom, what happened yesterday then? Did you fall off the horse?
Yeah.
And what did you do?
I don't know.
So it's more a question of people looking for the telltale signs, like
Yeah, be alright.
a hand on the shoulder, or if he has a migraine, he might go off to his room, hold his head in his hands. So that requires a response from other people. You know, Tom, you've got a headache, do you need a tablet? It's very important that there's a record of things that have happened, or things which are important for all members of the team to know about a person. And it's exactly these sorts of things that are likely to come out.
Tell me whereabouts it hurts.
I guess the most important thing for people who are supporting someone to manage pain is that they know the person really well, and that they know that, especially if the person doesn't express pain, they know what the signs might be that somebody might be in pain, so that they can hopefully do something about it.
Does it hurt anywhere else?
No.
Many people find respite from pain and discomfort through alternative therapies.
Pain is very powerful, and the level of pain is personal. Pain is what a person says it is. I feel the most important thing is actually knowing the person and to nurture a sense of trust with that person. Paul's medical conditions mean that he presents with many involuntary movements, and he copes amazingly well with all that. When Paul has Reiki, then he is very still, and he has described periods of just beautiful relaxation.
Normally I can't keep myself still because I've got Parkinson's, advanced Parkinson's. I've tried all sorts of different treatments, but half of it is getting you to relax. When I come to here and get something like this, it's like magic. If
a person has a particularly strong relationship either with their GP or their district nurse, then in coming here it's important that they know that we communicate and work with them.
There we go.
From a management point of view, if a drug has been designed for regular dosage, for example, if a person has Parkinson's disease, then their drug regime may dictate that for optimum effect that they are taken regularly. If a person can achieve a tolerable level of pain, for example, if they have cancer, they can begin to feel whole again.
I've came back today and before that I was down in the dumps, completely, utterly down there. And I didn't want to do anything, didn't want to talk, didn't want nothing. After the initial shock of getting their fingers and everything and the little pins, after that it starts to get a nice glow, it goes up wherever the pain was, it seems to go away as well. Really helps, a nice warm glow. It's hard to describe, but you know, when you come in from the winter's cold, you have a cup of nice whatever, it really helps. The swelling's down and I can get my shoes on then again. I honestly think a lot is in the mind and it's up here. It's not anywhere else. And you need alternative somewhere. Or to the art. I was absolutely useless at art. Completely. But Edwin, the instructor here, he taught us how to look at things different. Well, you forget all about the pain because you're too busy engrossed. And I really get lost in it.
Pain management is all about holistic support and just helping people to be who they are for as long as it can be.
Try anything, get it out of your head, because 80% of our sure is up here. Get the pain out of your head. Do something.